At Sierra, discover great deals on top brand workout gear, like high-quality walking shoes, which might lead to another discovery.
40,000 steps, baby. Who's on top now, Karen?
You've taken the office step challenge a step too far. Don't worry, though. Sierra also has yoga gear. It might be a good place to find your zen. Discover top brands at unexpectedly low prices. Sierra, let's get moving.
Hey, business owners, we know you know the importance of maximizing every dollar. With the Delta SkyMiles Reserve Business American Express card, you can make your expenses work just as hard as you. From afternoon coffee runs to stocking office supplies and even team dinners, you can earn miles on all your business expenses. Plus, you can earn 110,000 bonus miles for a limited time through July 16th. The Delta SkyMiles Reserve Business Card. If you travel, you know. Minimum spending requirements and terms apply. Offer ends 7/16/25.
In the first 6 months of this year, the measles outbreak that started in a small Mennonite community in Texas has slowly been growing.
Spread to a couple of nearby states, New Mexico, Oklahoma, and we've also seen outbreaks pop up across the country from South Carolina to Montana. This disease is all over the place.
That's Dylan Scott, a senior correspondent at Fox. In those first 6 months, kids were in school, which gave the disease the opportunity to spread. But Dylan says it also means that children were in a routine. They were going to school, coming home, and generally staying pretty contained in their community.
And now it's summertime, and suddenly people are going to be moving all over the place. You know, I sent my kid to his recreation center summer camp this week. I think a lot of other parents are doing the same. People are taking family vacations, you know, getting into airplanes, going to crowded beaches or crowded museums and city parks. Like, everybody is out and about, moving around, interacting with other people during the summer. And for the most part, that's great. But unfortunately, when you have a highly infectious disease like measles going around, it does increase the opportunities that the virus is going to have to spread here for the next few months.
So much so that the CDC issued guidance last month specifically for camps and camp counselors. It listed new things for camps to do, like collect vaccine records from campers and checking with parents and camp workers who show up to make sure that no one has a fever or a rash or anything that might be an indicator of measles.
And they even have urged camps to kind of contingency plan and think about okay, somebody does test positive for measles in your camp. Can you set up a place for them to isolate, or for people who have been in contact with them to isolate? So, it's just been I think up until this year, for decades now, measles was not really something you had to think about if you were planning a summer camp or if you were sending your kid to a summer camp. But this year, it is something that at least you have to take into consideration when you're making your plans.
This week, the CDC issued a report that the U.S. had 1,288 confirmed cases of measles in the first half of 2025. That's the most measles cases in 30 years. And with travel, camps, and new routines in the summer, the next few months are crucial for getting measles under control.
If we can do a really good job here during the summer, I think it's all right, hopefully we'll kind of just be past what we've been dealing with for the last 6 months. On the other hand, if a bunch of little outbreaks are seeded over July and August, especially then with school starting back up in September, it would, in theory, create an opportunity for a lot more measles to spread.
Today on the show, we've just reached a record high number of measles cases. What we do next will determine if we can control the outbreak or live with measles going forward. I'm Shayna Roth, filling in for Lizzie O'Leary, and you're listening to What Next TBD, a show about technology, power, and how the future will be determined. Stick around. Speed and quality don't usually go hand in hand. But you wouldn't expect a drive-thru to hand you a 5-course gourmet meal. But when it comes to hiring, that trade-off doesn't always hold. It is possible to find top-tier candidates fast. Just use ZipRecruiter. And right now, you can try ZipRecruiter for free at ZipRecruiter.com/TBD. With ZipRecruiter's advanced resume database, you can proactively find and connect with qualified candidates in minutes, so there's little waiting. No wonder ZipRecruiter is the #1 rated hiring site based on G2. Experience hiring speed and quality with ZipRecruiter. 4 out of 5 employers who post on ZipRecruiter get a quality candidate within the first day. And if you go to ZipRecruiter.com/TBD right now, you can try it for free. Again, that's ZipRecruiter.com/TBD. ZipRecruiter, the smartest way to hire. This episode is brought to you by Agency. While single agents can handle specific tasks, the real power comes when specialized agents collaborate to solve complex problems. But there's a fundamental gap. There is no standardized infrastructure for these agents to discover, communicate with, and work alongside each other. That's where Agency comes in. The Agency is an open-source collective building the Internet of Agents, a global collaboration layer where AI agents can work together. It will connect systems across vendors and frameworks, solving the biggest problems of discovery, interoperability, and scalability for enterprises. Shape the future of enterprise innovation. Visit agency.org to explore use cases now. That's agntcy.org. I want to retrace our steps just a little bit and look back to when the measles outbreak first started. It started in a small community in Texas, but now it's in New Mexico, Oklahoma, and several other states. How has the situation evolved?
This outbreak really came onto the radar in Gaines County, Texas. And specifically, there appears to have been an outbreak in a religious community, a community of Mennonites, where there's more hesitancy about getting routine vaccinations, and some of the schools where the virus was taking off early on had really low measles vaccination rates. I don't think we know exactly how measles was introduced to this community, but once it found its way there, it was the perfect setting for measles, which is already a highly infectious virus, to just spread like wildfire. And so that's why we saw, there's been more than 700 cases in Texas as of now. And yeah, we saw just across the border in New Mexico, and then a month or two later, just across the border in Oklahoma, we saw that outbreak spread to different states. Now, I do think it's important to emphasize that some of the recent outbreaks that we've seen, in Kentucky and South Carolina just reported its first case here in the past few days. There's been an outbreak in Montana that I know public health experts are watching closely. It's not necessarily clear that those are related to the Texas outbreak. So far, public health experts are confident that the cases in Texas, New Mexico, and Oklahoma are linked and represent sort of the natural spread of a single outbreak. But some of these other cases may just be somebody's travel. A lot of cases get started with travel, and that may have been the case with Texas. We're not quite sure.
Measles cases do appear to be slowing down a little bit. Do we know what is behind that?
Yes, that is the good news. It seems like measles are slowing down. In March and April, we were seeing, upwards of 100 new cases every week. These days, it's more like a couple of dozen. So that seems to represent some real improvement. I think it's important to remember that 90% of the population is vaccinated against measles. And so once the virus has burned through these, insular communities with, abnormally low vaccination rates, it is eventually going to kind of run run into these walls in the general population of people who are vaccinated, who do have that protection, who are therefore going to be able to stop its spread. So I think it makes sense that eventually the virus ran out of people to infect in Texas once it had gone through some of these low vaccination communities. Going forward, I think the concern is basically that story could repeat a bunch more times, that different little outbreaks could be seeded around the country, and especially within, communities of unvaccinated people, it's going to be really easy for the virus to spread. And that could mean, more people getting infected, more people getting hospitalized, and potentially more people dying, before the virus runs into that wall of vaccination in the general population.
For those of us who grew up not really knowing anything about measles at all, because it had been largely eradicated and it wasn't really on our radar, what are the symptoms of measles? What does this do to people?
Yeah, so it has some very common symptoms, like, fever, aches and pains, things like that. But the telltale sign of measles is the skin rash that comes with it. So, certainly if you have any reason to think you have been exposed and then you develop a rash, that's a reason to go talk to your doctor. But just in general, if you've not been feeling well, you start to develop a skin rash. Usually the measles rash is pretty easy to identify, but that's a good reason to go and talk to a doctor, get yourself tested, and figure out what's going on. The rash is usually a giveaway that this is measles and not something else, not your normal, cold and sniffles.
We have a vaccine for measles. How effective is the vaccine if you have it but are still exposed? Because it's a very contagious disease.
It is among the most contagious diseases on Earth. If I remember correctly, I'm not looking at the data right now, but it's something like, sort of in the wild with an unvaccinated population, it's like one person with measles can infect a dozen other people or more, which is, just a crazy R-naught, to borrow some infectious disease lingo. People, in the early days of COVID, when we were worried about that virus, when people thought it had an R-naught of like 3 or 4, they were really concerned because that's really infectious. So just think about measles is several times more infectious than that. But yes, to answer your question, like vaccination is the best tool that we have to protect people against measles because the vaccines that we do have are extremely effective. If you have gotten 2 doses of the MMR vaccine, which has been the medical standard since the late 1980s, it's a 97% effective. Basically, only 3 out of every 100 people who are vaccinated are going to get the measles if exposed to it. 97 of them are not going to develop symptoms or get sick or spread it to anybody else. So that is, we don't have a lot of vaccines that are 97% effective. The flu shot that we get every year is somewhere like 50% effective in like a good year. And it's still worth it from like a public health perspective. It still relieves makes the symptoms a little easier to manage. But with measles, it's like, no, you can get this shot and basically go about your day and never have to worry about it because it's 97% effective. And even for those 3% of people, much like with COVID or the flu, you might develop an illness, but it should be easier on your body because you have that vaccination and that pre-existing immunity.
Yeah. And the mortality rate for measles is relatively low, even if you do get it vaccinated or not vaccinated. But are there long-term health implications potentially?
Yes. So you're right. The measles fatality rate is about 0.1%, which is not super high. I do think it's worth emphasizing that like about 20% of people who get infected will end up hospitalized, which is obviously not a very pleasant experience to go through. And then, on top of that, there are some like longer term risks that come with developing an active measles infection. So the most, I think, notable one is what's called immunity amnesia, which is definitely like the scariest medical concept I've learned about in the past year. And so basically what happens is if you contract the measles, it's not just that like you get really sick and it overworks your immune system. It works your immune system so hard that like these about half of the antibodies that your body possesses at the time of your infection against any pathogen, not just the measles, but basically anything that you have developed immunity to over the course of your life, gets wiped out. And so suddenly you're like at a higher risk for all of these other viral infections that you had developed immunity to before you got the measles. So this, before we had vaccines, back in the early 20th century, this was a really active concern for doctors. They were always watching their patients closely for a long time after a measles infection because they knew that pneumonia, flu, cold, all these other things that you've been building up some protection against over the course of your life, that protection is going to be a lot weaker after you've been through a measles infection. So that's the big one. On top of that, there is a rare but real risk of fatal brain swelling can develop even years after you have a measles infection. There are some people who develop hearing loss because of ear infections that they experience during their illness. So yeah, measles, you'll hear people like Health Secretary Robert F. Kennedy Jr. talk about the measles as kind of no big deal. But it does have a fatality rate that's worth taking seriously. 3 people have died in the U.S. this year, which were the first deaths from measles in the U.S. in a decade. And beyond that, you could end up in the hospital for a while, and then you have this sort of long-term lingering risk of, your immune system being compromised and even, a small, but, not non-existent chance of brain swelling or hearing loss over the course of your life.
When we come back, how mixed messaging from U.S. health officials exacerbates the problem. This podcast is brought to you by Smalls. Is your cat ready for a diet upgrade? Then you need Smalls cat food, named the best overall cat food by Cats.com. After switching to Smalls, 88% of cat owners reported noticeable improvements in their cat's overall health. That's because Smalls cat food is packed with protein and made with preservative-free ingredients, giving your cat the high-quality meal they deserve. And it's delivered right to your door. Plus, Smalls has donated over $1 million worth of food to help cats through Humane World for Animals, so you can feel good about every purchase. The team at Smalls is so confident your cat will love their product, you can try it completely risk-free. What are you waiting for? Give your cat the food they deserve. For a limited time only, because you are a What Next TBD listener, you can get 60% off your first Smalls order plus free shipping when you head to smalls.com/TBD. That's 60% off when you head to smalls.com/TBD plus free shipping. Again, that's smalls.com/TBD.
If you're running a business, you know how important it is to stay connected to your customers, and having a flexible and efficient phone system is essential to succeed. Introducing OpenPhone, the #1 business phone system that streamlines and scales your customer communications. OpenPhone works through an app on your phone or computer, and your team can share one number and collaborate on customer calls and texts like a shared inbox. That way, any teammate can pick right up where the last person left off, keeping response times faster than ever. Plus, with AI-powered call transcripts and summaries, you'll be able to automate follow-ups, ensuring you'll never miss a customer interaction again. So whether you're a one-person operation or have a large team that needs better collaboration tools, check out OpenPhone. See why over 50,000 businesses trust OpenPhone to manage their business's calls and texts. OpenPhone is offering TBD listeners 20% off your first 6 months at openphone.com/TBD. That's openphone.com/TBD. And if you have existing numbers with another service, OpenPhone will port them over at no extra charge. OpenPhone. No missed calls, no missed customers.
This podcast is brought to you by Progressive Insurance. Do you ever think about switching insurance companies to see if you could save some cash? Progressive makes it easy. Just drop in some details about yourself and see if you're eligible to save money when you bundle your home and auto policies. The process only takes minutes, and it could mean hundreds more in your pocket. Visit Progressive.com after this episode to see if you could save. Progressive Casualty Insurance Company and Affiliates. Potential savings will vary. Not available in all states.
Well, speaking of RFK Jr., the CDC still recommends that children get vaccinated against measles. But as you pointed out, he, as the country's top health official, has pretty loudly walked back from urging people to get vaccinated. What does that kind of mixed messaging have on the public perception of how people should protect themselves from measles, or if they need to at all?
It's been sort of a strange experience to follow this because usually the CDC, as sort of like just an entity with nobody's name attached to it, continues to say the right things. Like you say, they still say vaccination, the best way to protect themselves. You know, they were sending out that guidance to summer camps, like urging them to collect vaccination records and isolate people. RFK Jr. himself even wrote an op-ed, and who knows if he wrote it or a staffer wrote it. Who knows? It's not for me to say. But the headline on Fox News was like, measles vaccination is important. So in a lot of official statements, they're saying all the right things. But then RFK Jr., if he's just more speaking off the cuff or like in a sit-down interview with a journalist, he does continue to sow doubts about both the seriousness of measles as a disease, but also about the safety of the vaccines. So, you know, he's talked about how like, well, back in my day, everybody used to get the measles and we just kind of dealt with it. And, you know, he's continued to make offhand comments about like, you know, we may not fully understand the dangers of these things. And like, it's possible that the vaccines have hurt more people than they've ultimately helped. And, you know, he's talked about alternative treatment options like vitamin A or cod liver oil, stuff like that, which to your point, I think just creates it does create the risk that people will just be confused about like, what am I supposed to do? You know, we do have evidence that getting vaccinated after you've been exposed to measles can help like with the progression of the illness. Like it might be less severe if you get a vaccine early on shortly after you've been exposed. But like, it's not like RFK Jr. is out there urging all of these people who've been exposed in West Texas to go get vaccinated. Instead, he's sort of feeding into their vaccine hesitancy. There's been reporting that he, you know, has been in contact with doctors in the area who, let's say, practice a more alternative style of medicine and maybe focus more on those alternative treatments as opposed to vaccinations.
This mixed messaging has directly led to Americans questioning if measles is something they should take seriously.
Gallup has been tracing this question for about 25 years now. And back in 2001, 94% of Americans said it was extremely or very important to get your child vaccinated against measles, which is, you know, the kind of consensus that's just unimaginable these days. But today, that number has fallen to about 69%. And I do think that is explained by just sort of like the constant din of people like RFK Jr., especially in his HHS secretary days, just sowing doubts, just making, you know, suggestions about like, are we sure this is safe? Are we sure about the ingredients? And just having, and, you know, those folks have gained more and more of a platform as the years have passed. I think COVID was clearly a real accelerant for vaccine hesitancy that a lot of these folks kind of tapped into to their great success based on, you know, the change in attitudes that I just described. Because it's even like, if you look at 2019, it was 84% of people said it was extremely or very important to get your child vaccinated against measles. That's 2019. And 5 years later, in 2024, that was down to 69%. So I think that's as good of evidence as you can find about the pandemic effect and unfortunately how it eroded a lot of people's trust in vaccines in general.
Yeah, and now RFK Jr. has fired 17 sitting members of the CDC Advisory Committee on Immunization Practices, which, given all of this vaccine hesitancy, seems bad.
Yeah, we're not getting any more clarity. Like you say, there's this expert panel that for more than 60 years has advised the federal government on like what our vaccine policy should be. And in one fell swoop, RFK Jr. fired everybody who'd been sitting on that committee, said they were compromised by their connections to the pharma industry, etc., and appointed 8 new members, many of whom have expressed the same kind of skepticism about vaccines that he has. At the same time, it's like you're also having these like independent medical societies who are watching what's happening at the federal government, with horror, trying to now like come up with like almost like an alternative CDC, like an alternative set of vaccine guidelines that, in their mind are more adhere to sort of the RFK Jr. science and the just mainstream conventional medical science. And like, I totally understand that impulse and the potential value of something like that, given what is happening in the federal government. But at the same time, like, you just imagine like parents who are like, okay, now should I listen to the CDC like I've been told to do for basically my entire life? Or should I listen to like the American, Academy of Pediatrics, who's now telling me not to listen to the CDC and instead to listen to them?
I think if you're a parent listening to this, you might be scared about your own kid potentially getting measles, especially if you have a newborn or a child who's young enough that they are not able to get a measles vaccination yet. Is there anything that you can do to protect them?
It's important to remember that the vaccine schedule is a set of sort of suggestions and recommendations, not like hard and fast rules that must be followed. And within any of them, there's already some wiggle room. Like, for example, the CDC, even before this year, recommended, like, if you're traveling internationally with somebody who's between 6 and 12 months, especially to an area where measles does tend to circulate naturally, you should consider getting that 6-month-old vaccinated. And so, like, that's one option for parents, is maybe like if you've got a newborn, maybe start asking your pediatrician about the measles shot at 6 months instead of waiting until a year. So it's the most rote medical advice that there is, but talking to your doctor, understanding that there's some flexibility about this. And then I would also think about, like, it may be worth, if you're an adult who's around kids a lot, it may be worth double checking your own immunity. Because there are some people for whom the immunity from a measles vaccine either doesn't take or doesn't last. You can talk to your doctor about getting a booster shot, and therefore at least like kind of protecting yourself to try to protect the little ones around you. So there are certainly some options. I do think that like doctors are just they are certainly aware that measles is spreading more than it's used to. And so I wouldn't hesitate to sort of press them on some of these questions, figure out what your options are besides the, exact wording of the schedule as it currently exists. And yeah, I do think like this is where we're at. It's this strange place where it's like, I wouldn't want people to go around being like, going to the grocery store being like, oh my God, I'm going to get the measles. Like, especially if there's not like an outbreak in your local area. And if you're vaccinated, like your individual risk remains quite low. But it's worth just knowing, like, the chances that the vaccine didn't work for you and what you can do to check your immunity and what the flexibility is in the childhood vaccination schedule. Just making sure you know where your vaccination records are. Like, we are in this new area where it does seem likely that measles will be spreading with more regularity. And so just knowing how to like double check yourself or manage your risk in pretty low effort ways, like this is stuff that, yeah, for most of my life, it wasn't even something you had to consider. You didn't need to reserve any brain space for it. But these days you might want to carve out at least a little bit to be up to speed on measles and what you can do to protect yourself.
Dylan, thank you so much for joining us and lending us your massive expertise. We appreciate it.
Well, thank you for having me.
Dylan Scott is a senior correspondent for Vox. And that's it for our show today. What Next TBD is produced by Evan Campbell and Patrick Fort. Our show is edited by Elena Schwartz. Mia Lobel is the executive producer at Slate. TBD is part of the larger What Next family. And if you like what you heard, the best way to support the work we do here at Slate is to join Slate Plus. You get all your Slate podcasts ad-free, including this one, as well as exclusive bonus content. Just head on over to slate.com/whatnext to sign up. I'm Shayna Roth, in for Lizzie O'Leary. Thanks for listening.
Why does the United States pay higher drug prices than other countries? Because America's the only country in the world where 340B hospitals mark up drug prices and PBM middlemen charge billions in hidden fees. Meanwhile, Americans subsidize the research and development for new cures. Other countries benefit, but don't pay their fair share. Crack down on the middlemen. End the free riding. Lower drug prices. Go to balancethescales.org to learn more. Paid for by Pharma.